Good morning, USA, and good evening, India. I am Dr. Ritika Shah, and I would like to welcome you all to the GCAR Journal Club February meeting. A brief introduction about GCAR and Journal Club. Journal Club is an educational initiative by GCAR where we discuss published research articles and critical analysis to stay updated with latest research and promote evidence based Ayurveda. A little brief introduction regarding GCAR. I'll just share the website with you all. So GCAR, or Global Council for Ayurveda Research is an international non-profit organization based out of USA with a sister chapter in India by the name of Ayurveda Anusandhan Abhiyan Foundation, AAAF. Our mission is to encourage, educate, and facilitate basic clinical and interdisciplinary research in Ayurveda. Our vision is to promote and establish Ayurveda as an evidence based health science globally. You can learn more about us at www.ayurvedaresearchusa.org. Please consider joining us as a member, which will bring you access to all our resources, and no nonprofit can cooperate and succeed without volunteers. So please do consider joining us as volunteer, and we can place you in a variety of projects based on your skills and interests. Once again, our website is www.ayurvedaresearchusa.org. Now, I would like to introduce to our eminent speaker, Dr. Nisha Thadani. Let me stop sharing my screen. Welcome, Dr. Nisha. Dr. Nisha is a surgeon and a leading proctologist. She has done her post-graduation in surgery from D.Y. Patil University, Navi Mumbai, practicing since 8 years in various hospitals in Mumbai and out of Mumbai. She's currently working at D.Y. Patil Hospital, Navi Mumbai, as an assistant professor and consultant surgeon at Sai Snehadeep Hospital, Koperkherme. As a female surgeon, she has been able to draw attention to most women patients and mainly with problems concerning proctology. She has created awareness about the prevention of piles, fissures, and constipation on a large scale, especially among females of the reproductive age group, as they are more prone to these ailments. She has mastered advanced surgical techniques such as laser fistula treatment, laser piles treatment, colorectal surgery, laser fissure surgery, laser pilonidal sinus treatment, laser surgeries for varicose veins, and stapler hemorrhoidectomy, MIPH, minimally invasive procedures for piles. She also specializes in authentic Ayurvedic treatments and various therapy as Shah Sutra for fistula and ano, pilonidal sinus, medicated enemas for piles fissures. She believes in an integrative approach towards treating her patients, that is, weighing the benefits and then using the best suitable treatment for them. In the Journal Club meeting, today she will be talking about management of Shirajanya Dushtavrana with special reference to varicose ulcer. Over to you, Dr. Nisha.
Thank you, Dr. Ritika, for the wonderful introduction. Should we start paper presentation?
Yes, you can start. Okay. You can share your screen.
So, welcome to Global Council of Ayurveda Research Journal Club. Today's research paper for discussion is Management of Sirajanya Dushtavrana with special reference to varicose ulcer. I have published this paper long back, I have done my post-graduation research project on this clinical study of Sanchamni Vadi and Jatyadi Tel for local application in the management of varicose ulcer. On this study, this paper has been published. Um, so this presentation is for academic purpose to understand methods for critically uprising a scientific manuscript. It by no means intend to harm or criticize the investigators or any other personal connected to the manuscript or clinical study. The view expressed here with sole purpose to be academic. The presenter declared no conflict of interest. So we are going to start our paper presentation with an introduction of our disease, introduction of the medicines that we have used in this study, and Ayurvedic perspective of this disease, that is varicose ulceration. So varicose vein are the penalty, are the part of penalty we pay for the adoption of erect posture. The overall incident rate is 0.67 in men and 1.42 percentage in women. Varicose vein can lead to varicose ulceration. Most common etiological factor include increased intravenous pressure, secondary to DVT, chronic constipation, long-standing occupation. Chronic long-standing cases of varicose vein render valve incompetent, resulting in venous hypertension, allowing blood protein fibrinogen leakage causing varicose ulcer. Varicose ulcer is a severe clinical manifestation of chronic venous insufficiency. It is responsible for about 70% of the chronic ulceration of the lower limbs. The pathogenesis starts with a dysfunction of venous valve, causing persistently increased intravenous pressure, which damages the venous wall and result in the stretching of superficial veins, loss of elasticity, hyperlipodermatosclerosis, which causes hyperpigmentation of the lower limb, that is blackish appearance of lower limb because of varicose vein and varicose ulceration that causes eczema or dryness of the extreme dryness of the skin, and finally that ulceration formation is happens in the lower limb at the lower limb. Confirmation of the diagnosis is done by a venous color Doppler ultrasound scanning for the lower limb. um, Conservatively, disease can be managed with compression stockings, foot elevation, oral antibiotic, and daily dressing of ulcer. Surgical management consists of ultrasound guided foam sclerotherapy, um, ELVA, that is endovenous laser ablation, that is the most advanced technique, radiofrequency ablation, and saphenofemoral ligation and long saphenous vein stripping, skin grafting, etc. So in Ayurveda, the comprehensive management of all vranas is exclusively described by Acharya Shushruta under Shashti Upkrama, that is 60 procedures for wound healing. He has described wound from its different aspects, right from the definition, causes, types, and their management in details. While describing the type of vranas, Shushruta mentioned the term Dushtavrana, having clinical features which resemble to the non-healing type of wound occurring to present medical sciences. Sorry, Acharya Shushruta has also explained about vranas, which is located in lower extremities, eliminates pus, etc., or any serious discharge from below in upper direction, that is anti-gravity drainage, are difficult to cure. There are a lot of drugs in different formulation described for Vrana according to its site, type, chronicity, but the management of Vrana, particularly Dushta Vrana, is still a challenge for surgeons. Recent statistics reveals that the recurrence rate of varicose ulcer is quite common, ranging from 54% to 78% by the fifth year after healing. So there is a significant recurrence rate of varicose ulceration. If varicose ulcer is not treated properly or left untreated, wound infection causing increased pain, swelling, redness, and pus leading to cellulitis or gangrene, or eventually may lead amputation of the part of the limb, loss of mobility, and even severe complications like osteomyelitis, septicemia, malignancy, etc. may occur. Hence, we can say that in spite of all advances in health sciences, varicose ulcer management is still a difficult task. Jatiari tail that we have taken for the study for local application have runner open wound healing and runner shodhan wound cleansing properties which promote wound healing. Sira and Sanayun, as you all know, are the byproduct or Upadhatu of Rakta Dosh, and Sanshamniwati have Rakta Prasadani and Shodak, that is blood purification, Rakta Vardak, that improves hematopoiesis, and Shothar, that is anti-inflammatory characters. So Guruji worked as immunomodulator. Hence, this adjuvant treatment facilitates formation of healthy newer tissues, which promote the wound healing, and it also strengthens the blood vessels and helps in better blood circulation, thus venous valvular dysfunctions also. Need of the study. As I've already mentioned, recurrence rate of varicose ulceration is significantly high. The varicose vein affect almost 5% or more of the adult population in India. Venous disease is responsible for about between 60 to 70% of all ulcers in lower leg. In journal day-to-day life or in journal surgery, varicose vein and its complication are commonly treated. The treatment at this condition is a late sequel and is difficult to get completely cured. Recurrence of varicose ulceration is quite common, ranging from 54% to 78% by the fifth year after healing. Hence, in spite of all advances in health sciences, varicose ulcer management is still a difficult task. Alteration of medicine to avoid complication of varicose ulcer. Hence, in spite of modern therapy, this disease still has a ray of hope, and Ayurveda could be the solution. Whether this treatment will be effective in treating varicose ulcer, keeping this research question into center head of the study, an attempt has been. Aim of the study is to clinically assess the efficacy of Sanshamniwati orally or internally and Jateditel for local application in the management of varicose ulcer. Objectives of the study is to evaluate the role of Sanshamniwati in management of varicose ulcer, to evaluate the role of Chatyaditel for local application in the management of varicose ulcer, to evaluate the role of Sanshamniwati and Chatyaditel in the management of parameters of varicose ulcer, that is size of ulcer, pain, hyperpigmentation of the lower limb, granulation tissue around the ulceration, edema of foot, ankle, and calf, calf region. We'll start with a small disease review on varicose ulceration. So varicose ulcer are also known as stasis ulcer. This is most common etiology of lower extremity ulceration. Possible causes of varicose ulcer include inflammatory processes resulting in leukocyte activation, endothelial damage, platelet aggregation, and intracellular edema. The primary risk factor for varicose ulcer development are older age, obesity, previous leg injuries, deep venous thrombosis, and phlebitis. So, pathophysiology, varicose vein can happen due to three reasons: primary, secondary, or congenital. Secondary can be because of obesity, long-standing occupation. Primary is usually long-standing occupation, chronic constipation, obesity. Secondary can happen due to pregnancy and congenital. So in all these three reasons it causes dilated veins and venous valve dysfunction that leads to chronic venous insufficiency, and that leads to the symptoms like pain in calf muscles, dilated veins, or tortuous vein, varicose vein, or reticular vein can happen in both lower limbs, or and post-traumatic syndrome that happens and causes edema of the foot, ankle, joint, and lipodermatosclerosis that I've already mentioned is basically the hyperpigmentation of lower limbs, lower extremities, and that usually have that causes the dryness, extreme dryness of the skin, and then can cause stasis as eczema, and then after that it can cause stasis ulceration or venous ulceration. So pathology in delaying delay healing of varicose ulcer is starts with the dysfunction of venous valve causing venous hypertension, which stretches the veins. This allow blood protein to leak into the extravascular space. It isolates extracellular matrix, molecule, and growth factors, preventing them from helping to heal the wound. Similarly, leaking of fibrinogen and deficiency in fibrinolysis causes fibrin to build up around vessels, preventing oxygen and nutrition from reaching cells of the lower extremities. And this also plugs the vessels, causing ischemia around the wound, resulting in delaying in the wound healing. So the physical examination is venous ulcer are generally irregular, shallow, located over bony prominences. Granulation tissue and fibrins are typical part in the ulcer base. Associated finding includes lower extremity varicosities, edema, venous dermatitis, and lipidomatosclerosis. Severe complication can include cellulitis, osteomyelitis, malignant changes as well. Now, management, conservative management are leg elevation, inelastic compression. And elastic means patient can use 4-layer uh, bandages for compression therapy. Then intermittent pneumatic compression, daily dressing of the ulceration. Mechanical management includes internal medication that are used as pentoxifylline, ilioprost, oral zinc, antibiotic, antiseptics, and aspirin therapy. And that includes flavonoid extracts as well. Surgical management includes debridement, local debridement of the varicose ulcer if the wound is um, infected. Then skin grafting, surgery for venous insufficiency or varicose vein that are by EVLA, endovenous laser ablation, radiofrequency ablation, saphenofemoral ligation, and long saphenous vein stripping, etc. Materials and methods. So I have prepared Jatyadi Tel. Method of preparation was prepared by Sneha Vidhi according to Shushu Samhita Chikitsa Stan 31 Snehopa Yogi Chikitsa Adhyay. The proportion was used in 1:4:16, that is 1 part of Kalkadrava, 4 parts Sillatel, and 16 part of water was taken. Then 1 part each of jasmine leaf, nimble leaf, patol leaf, leaf of karanja, beeswax, madhueshti, kutaj, haridra, daru haridra, kutki, manjishta, padmaka, lodra, haritaki, kamal, kesar, purified tuth, anantamul, and seeds of karanchi were taken, thickly pulverized all the materials and triturate into the stone slab along with the water to obtain kalka out of it, combined with tillatel 4 parts and water 16 parts, cook the mix methodology to obtain the medicated tel. Preparation of Shanshamni Vati was also done. So we have taken raw material, that is fresh bark of guruchi, drug were cut in small pieces, crushed the guruchi pieces, then boiled it with the 4 times water, then till left 1/4 of it. Then this guruchi kwath was boiled over mandagani till it reached the thick consistency. Then contents were collected into the tray. The paste obtained was converted into the verti, and these verti were subjected to the tablet cutting machine and finally dried in dryer to reduce the moisture content of it. Methodology, so study design was an open, non-comparative clinical study where 50 patients of varicose ulcer with age group between 18 to 60 years were selected according to the selection criteria. Source of data, the patient were collected from inpatient and outpatient department of Shalatantra of Diva Patil Ayurvedic Hospital by simple random sampling procedure, fulfilling the selection criteria. Drugs and dosage, local application of Jatiya Retail once daily was given, and Sanchani Vati, that is 250 mg 2 BD orally, that is total dose of 1 gram was given. Duration of the study was 8 weeks. Clinical feature were recorded before the treatment, that is 0 day, and changes with the treatment were observed from first week till 8th week as per the case record form of the case sheet and prepared for the study. Follow-up patient were advised to come to the hospital for daily regular dressing up for 6 weeks and further follow-up for 2 weeks. Clinical observations were recorded systematically and thoroughly. Advised both knee stockings were advised protein-rich right and 2 pillow leg elevation at the time of sleeping and avoid dressing soakage, avoid barefoot walking. Selection criteria that includes inclusion criteria was patient diagnosed with varicose ulcer, patient irrespective of sex, religion, occupation, and economical status, patient in between the age groups of 18 to 60 years, patient not enrolled for any other clinical trial were selected. Then the exclusion criteria was patient was having embolism, bleeding disorder, arterial occlusion diseases, other infective skin disorders, etc. Patient with immunocompromised disease like HIV, cancer were not taken. Patient with diabetes and hypertension, patient with DVT and congenital venous pump failure, patient with history of previous surgeries of varicose ulceration was not taken. Gradation parameters, there are subjective and objective assessment. We have taken pain, that is according to the VAS scale we have taken. Then size of ulceration, granulation tissue, edema, that is in calf, ankle, and foot, and hyperpigmentation. These were the parameters that we have taken for the study. This is if patient is 100% relief, if there is no ulceration, then patient will be termed was cured. And if patient has got 99 to 76% of the relief, then it is markedly improved. If patient is 75 to 51% relief, then improved. And if there is no changes or up to 25% relief, then no improvement was given. Then laboratory investigations that we have done while enrolling before enrolling the patient was CBC and ESR, blood sugar, fasting, and postprandial to rule out diabetes or any other immunocompromised state. Then VTCT, that is any blood disorders, were taken. Venous Doppler study of both lower limbs was done. Sorry. Then urine test, sugar, albumin, and then HIV-1, HIV-2, and HbSAg were done. Observation and result. The observed data is grouped under two headings. That is, one is demographic analysis and second was clinically efficacy of treatment during the study. So a demographic analysis of the study shows varicose ulcer highly dominant among male adult in age group of 45 to 50 years with predominant of pitta prakriti and chronicity of the symptoms up to 2 years. Religion-wise dominant among Hindus as the study center comprises of a Hindu dominant population with patient occupation comprising long-standing working hours. Assessment of parameters. So we have done assessment for hyperpigmentation. As you can see here, 94% of patients were having heavy hyperpigmentation before the study and 6% on the medium hyperpigmentation. But post-study, usually 54% of the patient have got changes in the hyperpigmentation and came to slide, and 40% of the patient have definitely fully cured with no hyperpigmentation. Edema has been assessed on the calf, foot, and ankle, and there's a significant changes in the edema on the calf as well. 94% of the patient were having 100% edema and were having edema at the calf region. And after the study, we can conclude there is no edema for 62% of the patient, and 38% of the patient were having edema up to 25%. Edema on the ankle, it's same. You can see there is a significant change in the edema on the ankle as well. 74% of the patient were fully cured from edema, and there's no edema on the ankle for 74% of patient, and only 26% of the patient that were having edema up to 25%. Edema on the foot, as you can see, there's a significant change in the edema at the foot as well. So 74% of the patient post-study, there was no edema seen on the foot, and for 22% of the patient have edema reduced up to 75%. Granulation tissue. So as you can see, there is no granulation tissue. 74% of patient were having no granulation tissue at the time of enrollment, and post clinical study, 68% of the patient have got granulation tissue, that is 100% result, and 32% of the patient have got 75% of the wound covered with granulation tissue. So subjective parameters, again, for pain, we have taken VAS scale. So patient before study, 26% of the patient were having worst pain. That means they were having paresthesia, and 50% of the patient were having severe pain. 24% of the patient were having moderate pain according to the VAS scale, and post study we can conclude that 64% of the patient were having no pain at all, and 36 percentage of patient were having mild pain. Size of ulceration. So as you can see, the baseline we can see, and there is a completely cure or absence of ulceration that happens in 74 percentage of the patient, and 26 percentage of the patients size of ulceration was reduced by 75%. So this is the statistical analysis of parameters of patient before and after treatment. So as you can see, all the parameters like hyperpigmentation, edema on the calf, ankle, and foot, pain, granulation tissue, size of ulcers are significantly changed after the treatment of the patient. The result revealed that the estimated treatment showed significant improvement. That is, p-value is less than 0.001 in all cardinal sign and symptoms. Adjuvant treatment with Jatiyati Tel and local application and Chinchimnivati internally statistically proved to be much potent and effective in the management of varicose ulcer. So we can conclude that the ancient management is safe, easily available, devoid of complication, and has better acceptability. And next is overall result of the treatment was 10% of the patient, that is 5 patients were fully cured, where 54% of the patient, that is 27 patients, were markedly improved. Then remaining 36% of the patient, that is 18% patients were improved, but overall patient improvement was significantly visible. None of the patients showed no improvement in size of ulcer, and none of the patients showed worsened condition by adjuvant. So there are some other findings as well, that is statistical analysis of investigation. I have not concluded in my parameters of the study, but still we have some other findings as well. After assessing the hematological investigations before and after treatment, HB, RBC counts or BTCT, that is bleeding time and clotting time, are not statistically significant at 5% level. That is, p-value is 0.05, but there is a changes in, but WBC and ESR are statistically significant at 0.01%, that is, p-value is less than 0.001. So we can see there is a decrease in ESR count and WBC count of patient after the study. So that means infection of localized part on the ulceration was definitely significantly reduced in hematological findings as well. These are some images of the patient. As you can see, day one image of the patient that was having varicose ulceration. There was a large varicose ulceration and there was a severe hyperpigmentation as well. Day 20, the wound can be seen with the granulation tissue. And there is the image of day 60 as well. We have seen significant result in the size of ulceration and other symptoms as well. Then this is another patient image. As you can see, I was just in day one. We have measured the size of ulceration. Patient was having severe edema on the calf, ankle, and foot. Patient was having severe pain, came with paresthesia, and the condition after the treatment, that is day 30, we have taken an image There we can see there is a definitely improvement on edema of calf, foot and ankle joint, and there is a definitely significant reduction in the size of ulceration and paresthesia and other symptoms as well. So probable mode of action. Sanchamnivati have Guruchi, which comes in traditional rejuvenator Ayurvedic plant category. It supports in the functioning of immune system by maintaining sufficient levels of WBC, such as macrophages. It enhances immune system by expelling toxins from body and rejuvenating the body. Hence, it works as an immune modulator. Sira and Sanayo are the byproducts, Upadhatu of Rakta, and Sanchamnivati has Rakta Prasadhaniya character. Hence, it facilitates formation of healthy newer tissues and also strengthen the blood vessels. Thus, correct venous valvular dysfunction. As per Ayurvedic texts, Guruji purifies the Rakta Dhatu due to the Rakta Prasadaniya character. Further, once Rakta is purified, its byproduct, that is Sira, and its kinematics also gets pacified. Thus, make correct venous valvular dysfunction when used internally along with the adjuvant treatment. तिक्त कसाय रस मधुर विपाक उष्णवीर्य त्रिदोषामक and deepniya and dahan shamak are Guruchi's property. The chloroform and benzene extract of Guruchi were found to possess significant antibacterial activity as compared with the standard. Guruchi extract is useful in infections due to Proteus vulgaris, Staphylococcus aureus, Staphylococcus pyrogen, and E. coli. Guduchi also includes tenosporal chlor clomin, tenosporic acid, and palmarin. The drug possesses one-fifth of the analgesic sodium salicylate effect that is used in commonly as an analgesic medicine. Jatyadi tel is good shodhan, and that means cleansing, and Ropan healing drug. Most of the ingredients used in Jatyadi tel are Shotahar, that is anti-inflammatory, that helps in the reduction of inflammation and swelling. Vedana Stapin act as an analgesic. Ropak that acts and helps in the wound healing, which are important requirement of healing of the wound and relieves pain too. The ingredient like Nimba Patra and Daru Haritra are antibacterial and promote wound healing. Antibacterial action of jasmine. The extracts are subjected for screening of in vitro antimicrobial activity against selected disease causing pathogens like Staphylococcus albus, Proteus mirabilis, Salmonella typhi, etc. The result of antimicrobial activity reveals that it can be used as an antibiotic. Antifungal action of jasmine, the inhibition zone of methanol extract and leaves of jasmine and essential oil showed potential for antifungal activity as well. Yashti Madhu, that is Madhur Ras, Shitvedya, Pitta Vata Shamak, and Vrana Shodhar and Vedanahar are its properties. So it has anti-inflammatory activities, which is present in the as a content drug in Jatyadi Tel. So conclusion of our study is Jatyadi Tel local application in Samshamnivati orally is potent and effective. The combination have proven value in the management of varicose ulcer. These drugs significantly reduce the size of ulcer. Jatyadi Tel and Sanchamivati statistically also show significant decrease in venous congestion, resulting into the reduction of edema and hyperpigmentation and increase in granulation tissue and health and result into wound healing. These drugs do not have any effect on HB count, hemoglobin count, RBCs, BTCT, but it helps in decrease in WBC and ESR count. The complication with such therapies are wound infection, hypersensitivity, and bleeding. None of the complication was observed in the study. In view of no any adverse effect and affordable, economical by all, it can be recommended in combination for the adjuvant treatment of varicose ulceration. I do have some limitation of my studies, and there's a future scope as well. Multicentric trial can be carried out with larger sample size. In future, it can be used as an alternative option to avoid moderate treatment and surgeries. Histopathological study to prove the mechanism of healing of varicose ulcer with Chatya can be done in future. Thank you.
Thank you, Dr. Nisha. Thank you for this wonderful presentation today. It was really interesting to know about your research and see significant results, especially in edema. Like what you said or shared is that 70% of patients had no edema at all. That is amazing. And also the size of the ulcer had reduced. It's so amazing that Ayurveda has such simple solutions and amazing results. Like varicose ulcers is so common cause of amputation, and amputations, like because of Ayurveda, we can prevent that.
As I've
I had,
already mentioned,
yeah, please.
As I have already mentioned, there is a recurrence rate in modern therapy. The recurrence rate post-surgery also, post-debridement also is very, very significantly high. So these studies can definitely be useful for all the patients, and that can be readily economically available for all patients. So yes.
Yes, and it's so convenient also to use. It's not a very complicated treatment,
Yes,
especially when
patient
it comes
can.
to.
I was studying for my study, so I have asked all the patients to come for dressing once daily. But if we are not even we are advising Jatya de Tel for local application, the patient can easily do dressing at home also by himself
Oh,
only. Yeah, so that is definitely one of the best thing that we can do for the patient. He need not to go in and out from hospital for dressing to hospital. So definitely patient can use, easily
that's
can be used.
amazing. So that actually turns out to increase the compliance rate also. If it's very convenient, the compliance rate of the patient also increases.
Yes, yes,
Yeah.
yes.
I had one question. You mentioned in the introduction that like women are more prone to varicose vein. Is there any specific reason for that? Because I'm deeply offended because being a woman.
No, no, no. See, the primary cause for varicose vein is definitely equal in male and female, because the primary reason is our erect posture. That is a anti gravitational force that blood is running because of it. But the secondary reason for varicose vein is definitely pregnancy. So if women's definitely go through the pregnancy phase where they tend to increase weight, and obesity also increases, in that cases there is an extra weight that actually put congestion, blood congestion, lower extremities. So that can be definitely, that increases the chances of having varicose vein post pregnancy in patients, female patients.
Yes, absolutely. Absolutely. That sounds like a valid reason. I would like to ask, so there's one question from Vinayak. Vinayak, we've already gone through the treatment part, and due to the time constraint, we cannot repeat it. But we have a recording on YouTube, so you can definitely um, go through it. Garima, would you like to share your thoughts? You can unmute yourself and share your thoughts.
Thank you so much. It was a very nice lecture. I like it. I just have one question. How much was the dose of the Sanshamini tea? Means, are you giving it try 3 times in a day or 2 times in a day? And is there any
We have
interaction with any other drugs? Because patient don't come with single disease when they are coming with the varicose vein ulcer. So I will surely want to understand that what are the interactions and how much it will be safe to give to any of the patients.
See, I have already mentioned there was an inclusion criteria for selection of the patient. So we have not taken any patient with immunocompromised medical health state. So we have already excluded patient with hypertension, diabetes, and other disorders. We have only taken patients who have not taken any primary treatment for varicose ulceration, and which have not undergone any other trial or any other medication or previous surgeries. And dose of Sanchimnivati that we have taken here is 1 gram per day, that we have made tablets that are of 25 to 50 mg, and I have advised patient to take 2 BD, 2 tablet twice daily.
Okay, great. Thank you so much.
Thank you.
Thank you so much. Vinayak, do you have any other questions? I think he's not responding. Anyway, thank you so much, Dr. Nisha. It was a really informative and good presentation. I would like to thank everyone, all the participants. Thank you, Garima. Thank you, Vinayak, for joining us today. Thank you, rest of the participants. Thank you for attending this Journal Club meeting. Please watch and subscribe to our YouTube channel. This video will be uploaded on YouTube, and Vinayak, you can go and refer to that. And if you've missed out on any of this, you can go and check the video. You can stay updated with the latest research in Ayurveda. Please like, comment, and share the videos. Once again, I invite you to become a member and also fill out our volunteer form. You can now also subscribe to our Ayur Update newsletter to stay tuned to our projects and events. If you have any other questions, feel free to reach out to us and contact us at Ayurveda Research USA@gmail.com. Thank you again. Hope to see you again at the next meeting. Thank you all.
Thank you. Thank you for Ayurveda Research, Global Council for Ayurveda Research. Thank you, Dr. Ritika, for giving me this opportunity, and hope to see you all soon as well. Would like to present more papers like this.
Thank you.